You know, when an employer first hears what the living wage figure is, there is a bit of a sharp breath in when they hear what the number is, because it's quite a lot higher than the minimum wage. But then when you walk them through the calculation, something amazing always happens. Because instead of looking at the question of compensation through that market lens, when you instead walk them through the calculation of seeing what it actually costs to live and raise children here in the community where we are, it's this revelatory moment. They've never done it. And it creates this great opening. And for me too, you know, when you work in the policy field where so much of your work is a little esoteric and where wins just seem to be out of reach, this is a very real campaign. This is a very concrete campaign. This is when you can start to see wins that make an immediate material difference to people's incomes and to the situation of different households. And the other piece of it is that, you know, I give talks mostly in British Columbia, and I give talks around the province, in particular a lot on poverty reduction, which is my main area. Very often I'll have someone come up to me at one of those talks who might be from the municipal government or an employer themselves, and they'll say, well, what can we do? You know, it's all very well for us to advocate for a poverty reduction plan to the province or to the feds, but what can we do? And my answer is this: the living wage is what you can do. This is where the rubber hits the road for you. So for us, let me get this thing going. This started with a report that we did back in 2008, although it actually started earlier than that. Some of you may know, when the Gordon Campbell government was first elected in 2001 in British Columbia, one of the very first things that they did was they ripped up the contract with the hospital workers. And you had about 8,000 to 9,000 workers who were mostly women, largely immigrant women, many heads of households, who were cleaners and food service workers and security people whose jobs were contracted out at that point, and whose jobs were contracted out to Sodexo and Aramark and all of those multinationals that we all know all over the place, who used to make the living wage and then had to regain their jobs at about a 40% pay cut, well below the living wage. And a woman who was one of my board members, but who was also then the research director of the Hospital Employees Union, named Marcy Cohen, who's one of the authors of the first living wage report we did, came to us and said, you know, we should do something on the living wage. And she in particular had been watching how the campaign had been unfolding in London, England, which I'm going to tell you a little bit more about. And that's when we started the project and then produced the first report. And you know, for those of you who are familiar with CCPA, you know we produce a lot of reports, sort of, that's what we do. Reports are us. But this was different, where the publication of that first report really launched a campaign which has some growing infrastructure in British Columbia, which I want to walk you through, and where our organization remains very intimately involved in the campaign, and each year we update the calculation and help other communities with the calculation. So that's how it started for us. So first of all, let me offer some of the definitions and methodology that we use. First of all, what is the living wage? So it is different from the minimum wage. The minimum wage is the legislated statutory minimum that all employers have to pay, big and small. Very often with minimum wage campaigns, where we've seen some good and strong campaigns, they tend to use a methodology which is to say, what would the minimum wage need to be so that a single individual working full-time, full year would be at the poverty line? And right now in a major metropolitan center like Vancouver or Toronto, that would actually be about $11.50 an hour. So we're not there. The living wage sets a higher bar, and it uses a methodology, at least the one that we've been using and advocating, uses models on a family with young children. And it sets a higher bar as well than just the poverty line. It's also a very fine, specific community calculation. So the living wage in Hamilton is not going to be the same as Ottawa, is not going to be the same as Kitchener. It's looking at the actual cost of shelter, the actual cost of food in a given community. And the living wage call is a call not to the provincial government, but to employers themselves, primarily large public and private sector employers, to become living wage employers. And in so doing, committing to pay the living wage not only to your direct staff, but where it really starts to have an impact is when applied to their major local service providers, their major contractors. So while it's distinct, though, from the minimum wage, I do think these campaigns are very complementary. They support one another, because when you have that calculation of the living wage, and you realize what a huge spread there is between the minimum wage and the living wage, it just drives home, among other things, how completely inadequate the minimum wage is and why it too needs to go up in a complementary way. Part of the imperative is the poverty context. For us in BC, for 8 years in a row, we had the highest child poverty rates in the country. And when you engage people on child poverty, they tend to go right to welfare in their head, right? Welfare is an explanation for deep poverty in our societies, the inadequacy of welfare and the inaccessibility of welfare. But when we talk about the breadth of poverty, overall poverty, it isn't a welfare story. It's a low-wage story. The vast majority of poor children live in families with paid income. They're not on social assistance. In Ontario, there's the stat, 35% of poor children live in a house with an adult working the equivalent of full-time, full-year in the paid labor force. So there's that connection. There's the connection with healthy childhood development and that relationship with income. This was from a workshop that the hospital employees a union did with their members, asking them, what's your definition of the living wage? And you start to see items on the sticky notes that they put up. Some of them are about having enough money to buy a birthday present or go to the pool or that kind of thing. But equally, a lot of the items on there have to do with time. One of the interesting things about going through the exercise of calculating the living wage budget is you realize the living wage budget is what it is, and it's very modest. And if you don't make it in an hourly wage, you make up for it in time. You get another job. With those hospital employees union members, a staggering, when the union surveyed that membership, a huge number of them reported after that huge cut in their pay, reported taking another job, often in the same health authority. So this is like from a poster that the campaign has done up that's like a typical family agenda. But you end up in a scenario where, there's the shift that starts at 7 in the morning at the hospital, and then the shift that starts at 3 in the afternoon at the long-term care facility, and you never see your kids. And we all pay for it. And one of the ways that I think the campaign starts to engage people is because I think people intuitively get that in one way or another we all pay for it, and municipal governments pay for it. It's just a little cartoon emphasizing the time point. So that poster I just showed you was part of a larger poster that, that's my daughter in the front actually there, that the campaign recently did, and just to give you a size of these massive things that they've created that are starting to go up around town, trying to build the call there. That one sort of showing the 2 different refrigerators. So here was the process that we went through. So back in 2006, once Marcy convinced us we should do this, we convened around our table a group of academics and policy analysts and other partners, the egghead table as we called it, to start to develop the methodology. And then we did some outreach to others, the dietitians, the United Way, the Social Planning Council, Vibrant Communities, faith groups, number of unions, immigrant parent organizations. And we started to develop this whole process and principles and methodology. We then focus grouped, after we did our first run, we focus grouped it with employers and with parents, made a few modifications, and arrived at our methodology. But before we did any number crunching, we started with this. We started with principles. What was going to guide this exercise? And the principles that we came up with were that we would arrive at a wage in which the family would be able to participate in the social, civic, and cultural lives of their communities. It would ensure healthy childhood development. It would promote gender equality. It would be something more than a poverty line, but the way we described it is it would allow the family to escape severe financial stress. But on the other hand, it was important to us that it be seen to be conservative and reasonable. And it really did pass that test. So as I've walked employers and CEOs through the calculation, I told you that you often get that balking when they first hear what it is. But then we walk them through the calculation, and I've never once had the experience of an employer say that it struck them as unreasonable. And then the other piece of it is that we wanted to come up with a methodology that would capture the role of the labor market and the role of good public policy and the social wage, all intertwined. So our methodology and our assumptions are that we model this on a family of 2 parents with 2 young children, age 4 and 7. When we're finished, we also run the numbers for a single parent with 1 child to make sure that it also works for them. Where both parents are working full-time, so 35 hours a week each. We're assuming that the youngest child's in full-time daycare, childcare, and that there's after-school care for the 7-year-old. And we arrive at a formula where we're basically looking at what's their overall budget, their expenses, and that would equal their income with the living wage, plus their government transfers like the child tax benefit or the GST credit, minus what they're paying in taxes, and from that we'd produce the calculation. We're looking at their expenses, in our case, in 10 areas. So this lists those areas. It lists what the source is, and right now in Metro Vancouver, what that amount is as of this year. So the food is coming from the dietitians, the clothing amount is coming from HRSDC's market basket measure, the shelter is coming from CMHC, and that shelter amount is a very conservative amount. I mean, you all hear in the news about Vancouver's housing situation. It's even worse than here. And what's interesting about that is that tells you what the average is for a 2 or 3 bedroom apartment. But if you actually had to move, it's not what it is in the vacancy rate. You'd be hard pressed to find a place in Metro Vancouver at that amount. All of which are some very conservative elements that we built into the calculation. You'll notice that childcare is the second most expensive item in there after shelter. The other category is from the market basket measure, and it's household items and furniture and toiletries and that kind of thing. Very modest recreation and entertainment budget. MSP, that's unique to us. We're the only province that has individual medical service premiums. And then an amount for non-covered health things like dental care and vision, a very basic plan. The parent amount was something that came out of the focus group with parents, where they said, well, you need a wage that's at least a path out of poverty. Include money for a couple of courses a year at a college to upgrade our education. So we did. And then the final amount is 2 weeks' pay, basically to cover real life. When emergencies happen and a death in the family and stuff happens that you can't work. And you tally it all up and you get a monthly amount that looks like that, about $5,300, or an annual budget that looks like that. But the family actually needs to make more than that because the family is paying more in taxes than they're getting in government benefits, which is a whole other interesting conversation about the thresholds around many of those benefit plans. And you end up in Metro Vancouver with the total living wage that as of this year is now over $19 an hour. It was 16-something when we started this exercise, now it's 19-something. But just to emphasize how conservative this is, this family doesn't own a house, they rent. They're not saving for their retirement. They're not putting money into an RESP for their kids' post-secondary education. And we've also put them in this parallel universe where they have no debt or credit card payments. All of their cash flow is even lickety-split. And then the recreation entertainment budget's very modest, as I mentioned. Now, the neat thing is that the methodology we've developed, and we do each year for Vancouver, is spreading all over the province. So almost 10 communities in British Columbia have calculated And you can see, it ranges from 14-something to the high of 19 for us, reflective of different costs of housing in particular. So I just want to switch gears from all of the number stuff to talk about the campaign as it stands in British Columbia. What's neat about it is that it's become a partnership now of dozens of organizations. So the campaign is housed with First Call, which is our provincial chapter of Campaign 2000. There's us, there's the United Way, there's a number of unions, including the CLC and the hospital workers and the provincial government employees and the United Food and Commercial Workers and the teachers. ACORN is there, the District Parent Advisory Committee is there, faith groups are there, immigrant serving groups are there, Van City Credit Union, Vibrant Communities. It's been endorsed by the Medical Health Officers Council, by the dietitians, which is a point I want to emphasize. Strategically, it's been really valuable. I would say we have seen some campaigns earlier than ours in Calgary and in Kitchener-Waterloo in particular that were modeled on a single individual, and they arrived at a lower living wage, which might have looked more like a politically possible win. The problem is it also came with losses strategically in terms of the potential. By modeling it on a family and having as a guiding principle a wage at which you can ensure healthy childhood development, it's allowed us to, as a campaign, to make common cause with all those other groups out there that are working on child poverty and healthy childhood development. And so they're all there as well. And the campaign has unfolded on two tracks that we've started to build infrastructure for. So the first track is focused on large public employers, in particular municipalities. And so New Westminster, 2 years ago, became the first city in the country to formally become a living wage employer. And tomorrow on the panel, you'll hear from Jamie McAvoy, who's the city councillor who was the champion of that in New Westminster. We've had a call that's been growing directed towards many other municipal governments, and we think a couple other wins are imminent. Earlier this year, the school board in Parksville on Vancouver Island, Nanaimo, Parksville-Qualicum became the first school board in the country to become an official living wage employer. And this is building on a movement that is long rooted in the United States. There's about 140 cities in the United States that have some form or another of living wage ordinance, although most of those are modeled on a single individual, not on a family. For us, though, the real inspiration came from London, England, where this incredible grassroots citizens group called London Citizens has built this campaign so that the City of London is a living wage city. The London Olympics were the first living wage Olympics. Many universities and hospitals there are also living wage employers. The second track in our campaign is directed towards private sector employers, both big for-profits and not-for-profits. And so these are some of them: Eclipse Awards, the United Way, Now Communications, Van City Credit Union, that have started to do it. Van City is the largest credit union in the country. SAP Business Objects, SAP, the managing director, is one of the other speakers tomorrow. Eclipse Awards went on to win this award as, ironically, they produce awards. They won an award for the best small business employer. All in all, we've now had 28 employers become officially certified as living wage employers, covering over 5,000 direct employees, but many, many more contract staff. And with those private employers, when you start to engage private employers on this, and they're thinking about whether or not they can do it, they tend to go right to the wage bill impact and think, could I afford it? Now, there is a wage bill impact. I don't want to be Pollyanna about that. But what we've sought to do is encourage them not to appreciate that there's another side to the ledger here, that they also experience savings in terms of productivity and lower recruitment and retention and training costs, that they're able to market themselves as a living wage employer. Because part of this process is that employers are seeking, applying to get recognized, they get vetted, And if they pass, there's this whole public signing ceremony, and they get this logo, which I'll show you in a moment, to put on their stationery and on their doors and that kind of stuff. What we also point out to employers is that the living wage calculation assumes no benefits. And so if they value those benefits, and we help them do that, they realize that they may not be as far off as they think they are once they could take those into consideration. So we now have this whole system set up where employers, there's an application form, they put it in, they have to commit to pay it both to their direct staff and to their contractors. It can be achieved through this combination of wages and benefits. And one of the things, SAP, in addition to becoming a living wage employer, on a pro bono basis, produced these 2 online tools for us. The first was for employers, where an employer can plug in, here's my lowest wage, and then it asks them questions. Well, are you covering health benefits? Do you have family leave provisions? Do you have this? And it monetizes those benefits and spits out for them what their adjusted living wage is. So that's one neat piece of infrastructure, which is shareable. But the other key piece is this, and as a policy guy, this is the thing that I most like about the living wage campaign. So I told you I present this a lot to employers. And I told you that I've never had an employer say it strikes them as unreasonable. But I have had employers say, okay, I get this, I understand the connection to child poverty, I see it's conservative, but I can't do it. I just face these competitive pressures, I can't do it. To which the campaign then says to them, okay, but if you get it, then become an advocate for lower public transit. Become an advocate for a higher child tax benefit. Become an advocate for more affordable housing. First and foremost, become an advocate for universal public child care, the second most expensive in the calculation. Because if any and all of those things happen, the living wage would come down. All of those things are hardwired into the calculation. And it invites employers to think of themselves, to realize that they too have a stake in this, because the calculation captures the balance between the role of the labor market and wages and the role of good public policy and who does what heavy lifting to get the job done of eliminating child poverty. And in the end, who cares who does which heavy lifting as long as it gets done? That's the logo they get if they become officially certified. And just to wrap with this, so in London, it's really taken off, where you've had many public sector employers becoming living wage employers, many private sector ones as well, many financial institutions on Canary Wharf are there already. This quote's kind of interesting because it's from the Conservative mayor of London. Now, the Conservatives didn't bring it in. Ken Livingstone brought it in. But it's become so embedded now and popular that regardless of a change in government, you have a Conservative mayor supporting it and indeed extending it. And this from KPMG, which is a living wage employer in London, not here. Now, they weren't keen initially. They kind of had to get pulled in, kicking and screaming. But after the fact, have become champions of it and sort of sing its benefits. And this is a picture from when London Citizens was having a mayoralty forum last time out. And you can see this is a vibrant community grassroots organization that can fill a church and fill a mosque when it comes to campaigns like this. I'll just end with this. It's a campaign that's still in its early days, I think, and it's starting to see successes. We've seen, the largest credit union, the first city, the first school board. But for me, what it would look like when it really starts to achieve its potential is you get enough large employers who do it, and then they create a market for those private service providers of janitorial services or food services who in turn pay the living wage. Now they have a recruitment and retention advantage over their competitors. And ideally, that point, with that critical mass, you start to see this positive ripple effect through the low-wage workforce where so many low-wage parents are working. We do need to standardize the methodology across the country, because it's been a little bit haphazard in terms of different initiatives everywhere. And in particular, as we start to win employers over, like SAP, that have offices across the country and may be keen to become living wage employers across the country, we need a standard methodology. It's always going to be a little different in every community. It always has to have a local group that's thinking through what makes sense, but using the same more or less assumptions and methodology. And I guess my argument to many would be, this is a great organizing tool. It lends itself to a lot of these campaigns, and it's linked to so many of the other campaigns that so many of us are involved in, whether it's the minimum wage or poverty reduction or the campaign for childcare or affordable housing or public transit. All of those things are hardwired in the calculation. So I will leave my opening at that and just say, enjoy the rest of the conference and good luck with it. Thank you.